Hi, my name is Dr. Steph Roche and I'm a general practitioner with a special interest in women's health. Today, to start off our menopause series, I would like to explain the basics of menopause. It is so important that we know this because 50% of our population is going to go through menopause. There's really no way around it. So we need to know some of the basic information so that we can better support our friends, ourselves, our colleagues and our families. So firstly, menopause is not just a change in your periods. The change in your periods is just an outward symbol of what's happening inside. So what's really happening is a huge hormonal shift, and I think we really don't pay enough attention to how huge this is. Women also experience symptoms on varying degrees of severity. So about a quarter of women have no symptoms, which is great. About 50% have some symptoms which are not too bad, but more than a quarter have severe disabling symptoms. And what we want to do is educate you about what you can do to support your symptoms during menopause, when to ask for help, so that we can make sure that you continue to live a full life, continue to run your businesses, look after your family, because it really is just the start of the second half of your life, and we want to have you to have a full life for the next few decades after your menopause. So what's happening is that instead of releasing an egg every month like you do during your reproductive years, as you start going through menopause, your eggs now run out. And that's actually protective because we don't want you to keep having babies forever. Instead of having those normal fluctuations which are produced by the egg cycle every month, your hormones start to drop slowly. So the main hormones here are estrogen and progesterone, and they're not only produced in your ovaries by your eggs, but that is the main source. So when you go through menopause and you're not having the cycle, your overall body levels of these hormones will decrease, which is what causes your symptoms. So when you start having symptoms, so hot flushes or a few other body changes, which I'll talk about now, we call that your perimenopause. We call it menopause once you've had no periods at all for 12 months. So menopause is a clinical diagnosis. You don't need blood tests. It's actually not recommended to do blood tests in women older than 45. They're really not reliable because instead of having the cyclical change in your hormones, they kind of go all over the place and then kind of down. So it's really not a reliable test to use. We rather just check your symptoms and then decide if you're in menopause that way. But we only call it menopause once you've had 12 months of no periods. And on average, women have menopausal symptoms for about 4 to 8 years, which is quite a while. The main symptoms of menopause differ across cultures, they differ between different people. So you have to be on the lookout for all of the different symptoms. And most people only know a handful, such as the hot flushes and your periods changing, but there's really so much more than that. So just from top to bottom. So starting with your brain, some women have brain fog, they have forgetfulness, some women have low mood or worsening anxiety. A lot of women have sleep disturbances. Then we also notice hair changes, skin changes. You can even get perimenopausal acne. Some women get heart palpitations, which is actually very common. You can also have joint aches and pains, digestive issues, weight changes. So some women gain weight, and we know that during menopause, women get more fat deposited around the middle area. So it's not something that you're doing wrong. You don't need to diet or change your exercise routine. This is a normal part of a change in body composition. And then we notice a lot of women have vaginal symptoms. So vaginal dryness, pain with sex. Women also experience loss of libido. And then finally, the one that's more obvious that most people already know is that your periods will start to change and eventually they'll stop. All of these symptoms can be due to menopause, but before we say that they're due to menopause, we have to exclude other causes. So for example, if you have palpitations, you should never assume that it's just menopause. Always go and see your doctor, whatever your symptoms are. You're not overreacting. Any of your body experiences and your feelings are valid. Go to your doctor. They'll do tests depending on your symptoms just to make sure it's nothing else. For example, if you had palpitations, you would often get an ECG, you might get blood tests. And then once we've excluded any other medical causes, that's when we'll say it's due to menopause. But you're not going crazy. These symptoms are very real due to the hormonal change changes in menopause. So in our next videos, we'll talk about how we manage the symptoms and different techniques such as pelvic floor physiotherapy, vaginal estrogen and hormone therapy. Let us know if you have any specific questions and we'll try to tackle those as well.